Welcome to the Medical Licentiate Emerson. Today, it's depression. Depression is more than just feeling sad. It is a serious medical condition that affects millions worldwide. The World Health Organization recognizes depression as a leading cause of disability. This illness carries a significant social and economic burden. Depression manifests in various ways. Symptoms include persistent sadness, loss of interest, fatigue, and changes in sleep and appetite. Individuals may experience difficulty concentrating, feelings of worthlessness, and even suicidal thoughts. The complex nature of depression makes diagnosis and treatment challenging. There is no single test to confirm depression. Healthcare professionals rely on patient history, symptom evaluation, and physical examination to make a diagnosis. Effective management of depression often involves a multifaceted approach. This may include psychotherapy, lifestyle modifications, and medication. Antidepressants are a crucial part of treatment for many individuals. The human brain relies on a delicate balance of chemicals called neurotransmitters for communication between nerve cells. Serotonin, norepinephrine, and dopamine are key neurotransmitters involved in mood regulation, motivation, and pleasure. Research suggests that an imbalance in these neurotransmitters plays a significant role in the development of depression. The monoamine hypothesis proposes that depression arises from a deficiency in serotonin, norepinephrine, or dopamine. While this hypothesis provides a valuable framework, it is an oversimplification of the complex neurobiology of depression. Other factors, such as genetic predisposition, environmental stressors, and hormonal changes, also contribute to the development of this disorder. Antidepressants primarily target these neurotransmitters to alleviate depressive symptoms. They work by increasing the availability of serotonin, norepinephrine, and dopamine in the brain. This helps to restore chemical balance and improve communication between nerve cells. Antidepressants encompass a diverse group of medications with varying chemical structures and mechanisms of action. They are broadly classified into several categories. Tricyclic antidepressants, or TCAs, were among the first antidepressants developed. They are effective but have a higher risk of side effects compared to newer antidepressants. Examples include amitriptyline and imipramine. Selective serotonin reuptake inhibitors, or SSRIs, are the most commonly prescribed antidepressants today. They are generally well tolerated and effective for a wide range of depressive disorders. Examples include fluoxetine, sertraline, and paroxetine. Serotonin norepinephrine reuptake inhibitors, or SNRIs, are similar to SSRIs but also affect norepinephrine levels. They are often used to treat depression with prominent fatigue or pain symptoms. Examples include duloxetine and venlafaxine. Monoamine oxidase inhibitors, or MAOIs, are an older class of antidepressants that require a strict dietary regimen due to potential interactions with certain foods. They are reserved for cases where other antidepressants have failed. Examples include phenelzine and tranylcypromide. Atypical antidepressants encompass a diverse group of antidepressants with unique mechanisms of action. Examples include bupropion, mirtazapine, and trazodone. Each class of antidepressants has its own set of advantages and disadvantages. The choice of antidepressant depends on the individual patient's needs, medical history, and potential side effects. Each class of antidepressants exerts its therapeutic effects through distinct mechanisms. Tricyclic antidepressants, or TCAs, block the reuptake of both serotonin and norepinephrine in the synapse, which is the space between nerve cells. This increases the levels of these neurotransmitters available to bind to their receptors and enhance neurotransmission. Selective serotonin reuptake inhibitors, or SSRIs, selectively inhibit the reuptake of serotonin in the synapse. This leads to a greater concentration of serotonin in the synaptic cleft, promoting serotonin signaling. Serotonin norepinephrine reuptake inhibitors, or SNRIs, block the reuptake of both serotonin and norepinephrine, similar to TCAs but with a more balanced effect on both neurotransmitters. This dual action contributes to their efficacy in treating both emotional and physical symptoms of depression. Monoamine oxidase inhibitors, or MAOIs, inhibit the enzyme monoamine oxidase, which is responsible for breaking down serotonin, norepinephrine, and dopamine. By inhibiting MAO, these antidepressants increase the overall availability of these neurotransmitters in the brain. Atypical antidepressants have diverse mechanisms of action. For example, bupropion inhibits the reuptake of dopamine and norepinephrine. while mirtazapine enhances both serotonin and norepinephrine transmission through complex receptor interactions. Understanding the different mechanisms of action is crucial for selecting the most appropriate antidepressant for each patient and managing potential side effects. Prescribing antidepressants is a personalized process that requires careful consideration of individual patient factors. A thorough medical history, including any personal or family history of depression, other medical conditions, and current medications, is essential. The type and severity of depressive symptoms, such as sleep disturbances, fatigue, or anxiety, can guide antidepressant selection. Different antidepressants have distinct side effect profiles. Discussing potential side effects and choosing a medication with minimal risk for the individual is crucial for patient adherence and treatment success. Checking for potential drug interactions with other medications the patient is taking is vital for preventing adverse events. The therapeutic effects of antidepressants are not immediate. It typically takes several weeks of consistent treatment at an adequate dose to observe significant improvement in mood and other symptoms. Regular monitoring and follow-up appointments are crucial for assessing treatment response, managing side effects, and making any necessary adjustments to the medication regimen. Prescribing antidepressants in specific populations, such as pregnant women, children, and older adults, warrants special considerations. The use of antidepressants during pregnancy requires careful risk-benefit assessment. Some antidepressants may pose risks to the developing fetus, while untreated depression also carries risks for both the mother and the unborn child. The developing brain is particularly sensitive to the effects of medication. Careful monitoring for potential side effects, such as suicidal ideation, is crucial when prescribing antidepressants to young people. Older adults may be more sensitive to antidepressant side effects due to age-related physiological changes. They may also have multiple medical conditions and be taking other medications, increasing the risk of drug interactions. In these populations, starting with a low dose, slow titration and close monitoring are essential for ensuring safety and efficacy. Non-pharmacological interventions such as psychotherapy and lifestyle modifications should also be considered as first-line or adjunctive treatments. While antidepressants have revolutionized the treatment of depression, there are still many challenges and areas for improvement. Ongoing research aims to develop faster-acting antidepressants. Current antidepressants often take several weeks to show significant effects. Research is ongoing to develop novel antidepressants with faster onset of action. Identifying biomarkers that can predict individual responses to different antidepressants could revolutionize treatment and improve outcomes. Research is exploring new targets in the brain beyond traditional neurotransmitters, such as glutamate and neuroinflammation, to develop more effective antidepressants. Techniques like transcranial magnetic stimulation, or TMS, and deep brain stimulation, or DBS, hold promise as alternative or adjunctive treatments for depression. The future of antidepressant therapy lies in a deeper understanding of the neurobiological underpinnings of depression and the development of personalized, targeted treatments. Continued research and innovation are essential for improving the lives of millions affected by this debilitating illness. Thank you for watching Medical Licentiate Emerson Educational Channel.